Medical School and Career Pathways in Medicine. Welcome to our introductory online course on Medical School and Career Pathways in Medicine. In this course, we will explore the different career paths available in medicine and provide an overview of what it takes to become a physician. Let's start with a brief introduction to medical school. Medical school is a graduate-level program that prepares students to become licensed physicians. To be eligible for medical school, students typically need to complete a pre-medical undergraduate degree, which includes coursework in biology, chemistry, physics, and mathematics. Medical schools also require students to take the Medical College Admission Test, MCAT, and to have volunteer or clinical experience in a healthcare setting. Once accepted into medical school, students typically complete a 4-year program that includes classroom instruction, clinical rotations, and practical experience. During the first 2 years of medical school, students focus on the foundational sciences of medicine, such as anatomy, physiology, pharmacology, and pathology. During the last 2 years, students complete clinical rotations in different medical specialties, such as internal medicine, surgery, pediatrics, and obstetrics and gynecology. After completing medical school, students must complete a residency program in their chosen specialty. Residencies typically last 3 to 7 years, depending on the specialty, and provide intensive training in clinical skills and patient care. After completing a residency, physicians may choose to pursue additional training through a fellowship program to specialize further in their area of interest. Now let's take a look at the different career pathways in medicine. There are many different specialties and subspecialties in medicine, and physicians may choose to focus on one or several areas of practice. Some common specialties include general practice/family medicine, surgery, obstetrics and gynecology, pediatrics, cardiology, oncology, psychiatry, anesthesiology, and emergency medicine. Within each specialty, there may be further subspecialties, such as neurosurgery or geriatric medicine. When selecting a career path in medicine, it's important to consider your interests, skills, and goals. Do you enjoy working with children? Are you interested in surgery or internal medicine? Do you have a passion for research and development? These are all factors that can help guide your career decisions. In conclusion, becoming a physician is a long and challenging journey, but it can be a highly rewarding career path for those who are committed to helping others and advancing medical knowledge. In this course, we will delve deeper into the different specialties and subspecialties in medicine and provide guidance on how to prepare for medical school and a successful career in medicine. Thank you for joining us on this exciting journey.